So what exactly is pelvic floor therapy and who needs it? Let's start with what the pelvic floor actually is. It's a group of muscles at the base of our body. This is a pelvis of someone with a vagina. Starting in the front, we have muscles that begin at our pubic bone, and they act like a hammock, and they go back to where essentially our tailbone is. They support our bladder, our uterus, and our rectum. And so think about the pelvic floor in three buckets: our bladder function, our bowel function, and our sexual function. People need to come and see a pelvic floor therapist if they're having issues with any of those three buckets. If you're having urinary leaking, urinary frequency, urgency, painful urination, or UTIs, that's a big you need to see somebody. Number two, bowel issues. If you're having chronic constipation, if you have IBS-like symptoms, abdominal pain, bloating, all of those things, also check the box of needing to see a pelvic floor specialist. And finally, any amount of pain with intimacy, inability to have an orgasm, or if you have hip or back pain following intimacy, even 2 to 3 days later, that also indicates that you may have pelvic floor dysfunction. So you need to see a pelvic floor specialist. You can follow us and reach out to us to have virtual or in-person bookings.